In this session, we'll deal mainly with the mid-tarsal joint and the subtalar joint. In order to reach them, we'll start with the joints of foot. If you observe the interphalangeal joints, these are the hinge joints and they have capsular and collateral ligaments. Metatarsophalangeal joints are ellipsoid joints. They have capsular ligaments, collateral ligaments, plantar and deep metatarsal ligaments. Tarsometatarsal joints are plain synovial joints. They have dorsal, plantar and interosseous ligaments. And intermetatarsal joints are plain synovial joints. Transverse or mid-tarsal joint and subtalar joint. So interphalangeal joints, these are hinge joint. Capsular ligament and collateral ligaments are there. Dorsiflexion and plantar flexion is allowed. Proximal joints are more mobile. So you can observe here, this is the distal interphalangeal joint and this is the proximal interphalangeal joint. Here you can see between the heads of the metatarsals and the proximal phalanges, metatarsophalangeal joints. These are the ellipsoidal joints, and you can see here the tarsometatarsal joints. These are the tarsometatarsal joints between the cuneiforms and the cuboid and the bases of the metatarsals. And here you can see the intercuneiform joints. Here you can see the cuneo-navicular joint. Here you can see the transverse tarsal joint at the mid-tarsal joint, where it has two components. On the medial side there is talocalcaneo-navicular joint and on the lateral side there is calcaneo-cuboid joint. Metatarsophalangeal joints, these are ellipsoid type of synovial joint. These are having the capsular ligament, collateral ligaments, plantar and deep transverse metatarsal ligaments. These plantar ligaments are connected by 4 deep transverse metatarsal ligaments. Dorsiflexion and plantar flexion, adduction and abduction movements are possible at metatarsophalangeal joints. The adduction and abduction movements are with respect to the second toe. So tarsometatarsal joints, these are plain synovial joints. The ligaments in relation to these joints are dorsal, plantar and interosseous cuneometatarsal ligaments. Then there are limited gliding movements which occurs at this joint. Then intertarsal joints, the plain synovial joints between cuneiforms and lateral cuneiform on the cuboid. In the subtalar joint, talocalcaneo-navicular joint, calcaneo-cuboid joint, cuneo-navicular joint. So mid-tarsal or transverse tarsal joint, this is the most important. It is having a medial component, the talocalcaneo-navicular joint, and a lateral component, calcaneo-cuboid joint. Both components are connected by bifurcated ligament. Talocalcaneo-navicular joint, it's a ball and socket type of joint, a restricted ball and socket type. And ball is found by the head of the talus. The concave surface is found by the navicular, plantar calcaneo-navicular ligament and facets on the upper surface of sustentaculum tali of calcaneus. The ligaments are the capsular ligament, talonavicular ligament, plantar calcaneo-navicular ligament, otherwise called spring ligament, and the bifurcated ligament, the medial part of the bifurcated ligament. If the spring ligament is torn, it results in flat foot. You can see here, this is the concave surface which is formed by the navicular facet, the facets on the sustentaculum tali and the spring ligament. This receives the head of the talus, forming the ball and socket type of joint. And you can also see this is the bifurcated ligament. This is the medial part and this is the lateral part. And you can see this is the dorsal calcaneo-cuboid ligament, which is related to the calcaneo-cuboid joint. And this is the interosseous talocalcaneal ligament, which is related to subtalar joint. You can observe here, this is the talus. You can see this is the head of the talus joining with the concave surface which is formed by the navicular, spring ligament and the sustentaculum tali, forming the ball and socket type of talocalcaneo-navicular joint. Calcaneo-cuboid joint, it is saddle or cellular type. The calcaneus anterior surface and the cuboid posterior surface will join to form the calcaneo-cuboid joint, which is saddle joint or cellular type. The calcaneal angle of cuboid supports the upper tilt of the calcaneus. It has capsular ligament, bifurcated ligament, short and long plantar ligaments. The long plantar ligament is the longest and strongest of the tarsal ligaments. Then a dorsal calcaneo-cuboid ligament and bifurcated ligament, which is Y-shaped. The stem is attached to the calcaneus. Anteriorly, it bifurcates into calcaneo-navicular and calcaneo-cuboid ligaments, as I've shown in the earlier diagram. You can see here this is the plantar calcaneo-navicular ligament as well as spring ligament on the medial side, and you can see here the long and short plantar ligaments. So this is the bifurcated ligament, this is the dorsal calcaneo-cuboid ligament, this is the interosseous talocalcaneal ligament, which we are going to deal with the subtalar joint. So subtalar joint, it is also called as posterior talocalcaneal joint. It's a modified multi-axial synovial joint. The ligaments are capsular ligament, medial and lateral talocalcaneal ligaments, interosseous talocalcaneal ligament, cervical ligaments. So inversion and diversion of foot occurs at subtalar joint. You can observe here, this is the subtalar joint between the talus and the calcaneum. You can observe this is the calcaneum. You can see these are the two articular facets on the sustentaculum tali, and you can see this is the articular facet on the middle one third of the calcaneum. Here you can also see the sulcus calcaneum. So this is the inferior aspect of the talus. Here you can see the articular facet, anterior calcaneal articular facet, and you can see the medial calcaneal articular facet, and here you can see the posterior calcaneal articular facet. This facet joins with this facet to form the subtalar joint. And this talar sulcus and the sulcus calcaneum, both when they are forming this subtalar joint, they form a sinus called a sinus tarsi, which will be bridged by the interosseous talocalcaneal ligament. Interosseous talocalcaneal ligament. So this is the interosseous talocalcaneal ligament. So inversion and eversion of foot. These movements are best demonstrated when foot is off the ground. Inversion movement, the medial margin of the foot is raised above the ground and the sole is directed downwards and medially. The muscles causing inversion are tibialis anterior and tibialis posterior. Eversion, the lateral margin of the foot raised above the ground, sole is directed downwards and laterally. The muscles causing the eversion are peroneus longus and peroneus brevis. You can see this is the axis around which there is inversion and eversion of foot. So dorsiflexion, plantar flexion, inversion and eversion. Dorsiflexion and plantar flexion are occurring at the ankle joint, whereas inversion and eversion are occurring at the subtalar and talocalcaneo navicular joints. Thank you.